Good day, everyone. For today's lecture topic, I will be discussing your fit testing, which is one of the component or one important component in order for us to identify the correct type and model of N95 mask that we will be using, especially if we will be attending to patients under airborne transmitted infections. We have two types of your fit testing, which are your quantitative and qualitative fit tests. When we talk about qualitative fit testing, it is a pass or fail test method that uses sense of taste or smell or reaction to an irritant to detect leakage into the respirator face piece. Now, in our hospital, this is what we are using in our hospital. The senses or the solution that we are using is a bitter solution. So once the healthcare workers who undergo fit testing will taste this bitter solution, meaning to say, or while taste this bitter solution while donning his or her N95 mask, meaning to say he or she failed the fit test. The other type of your fit test is we have your quantitative fit testing. It uses a machine to measure the actual amount of leakage into the face piece and does not rely on sense of taste, smell, or irritation to detect leakage. It produces a numerical result called a fit factor. A fit factor of at least 100 is required for half-mask respirators. In other hand, or in other words, when we talk about qualitative fit testing, it is more of a descriptive type of tests. So the description of the one who is being tested, if he or she sense, taste, or smell, or react to the irritant, that would determine the result of his or her fit test. Unlike with your quantitative, as what it is mentioned, it doesn't rely on the person's senses. So the machine will tell you if you fit the test or if you pass the test or not. If we have the two types of fit testing method that is available in the hospital, which among the two types is the preferred one? What do you think? So the preferred one, if we have the two types of fit testing method, is we have your quantitative respirator fit test. Okay? Quantitative. So it involves the use of a machine and does not rely on the person's sense of taste, smell, or irritation to the solution. So what is the indication for fit testing, or why do we do fit testing? All healthcare workers with potential exposure to airborne transmissible diseases that necessitates the use of N95 respirator, they should undergo fit tests. Okay, because the main reason why we do fit tests is for us to be able to identify the correct type and model of N95 mask that fits for us. Okay, because we have different types and models of your N95 mask, and not all those types and models fits for us. So we need to do fit testing so that we can easily identify which among of these N95 masks will suit us. How often are we going to conduct fit tests? Now, fit testing must be performed before starting the use of a respirator and must be repeated every year according to Occupational Safety and Health Administration or your OSHA. Fit testing must be repeated at any time when there is a change of respirator or there is facial change. Examples, the use of a different size or model of respirator. If there is, for example, if there is new or available, other available type of N95 mask that you were not able to do fit test with. So we need to do fit testing for that certain size, model, and type of your N95 mask. Other than that is we have, if you there is weight loss for the healthcare worker, cosmetic surgery, facial scarring, the installation of dentures or absence of dentures that are normally worn by the individual. Now, as you can see on the slide, this is the facial hairstyles and filtering face piece respirators. Ideally, fit testing should not be conducted for staff who have facial hair. Let's for example, beard that prevents the proper fitting of your N95 mask. In addition, wearers must be clean shaven to get a proper fit with a respirator. So as you can see on the slide, those that are checked, those are healthcare workers who have facial hairs that could probably undergo fit testing as long as your facial hair will not interfere in the wearing of your N95 mask. As for example, I have a facial hair only on this side or on this part. And if I'm going to wear N95 mask, it will not interfere in the fitting of my N95 mask. So that's not a problem. But if your facial hair is from here, it will interfere in the fitting of your N95 mask, especially on the edges of your N95 mask, then that is a problem and you cannot undergo fit testing because most probably you will fail. Now, what will happen or what will be the alternative device or respirator that you are going to wear if you failed the fit test or if there is any medical condition that will prohibit you in wearing N95 mask? So we have your PAPR or your powered air purifying respirators. It is a battery-powered blower that provides positive airflow through a high-efficiency particulate air or your HEPA filters that provides 99.97% particulate filtration efficiency that are used for protection of healthcare workers in healthcare facilities against respiratory airborne pathogens. When employee has facial hair or beard or facial deformity that interferes with N95 mask use, so you can wear your PAPR. Second one is the approved N95 mask is unavailable or unknown fit test. The third one is employee has failed fit testing with all available masks. So these are some of the conditions that you can wear your PAPR as an alternative for your N95 mask. And do not forget, and you should always remember, that powered air purifying respirators should be reserved for those team members that cannot safely wear a tight-fitting respirator mask. As you can see on the slide, that is your PAPR or your powered air purifying respirator parts and device. Okay? So that ends my lecture for fit testing. On the following slides or following video, you will see how do we do fit testing and how to don and doff your N95 mask. Thank you, and hopefully I can see you again on our next topic or next lecture, which is the cleaning and disinfection of your medical equipment.